Hey guys, we are going to go over the urinary system, so I'm going to share my screen. Give me a second. Probably can't see all this stuff showing up on my screen, but as always, got to move everything around. Okay. All right. Let's go ahead and fill out this sheet. Baric organs that filter blood and make urine. Those are the kidneys. Ureters are what conduct urine from the kidneys to the bladder. They're made of smooth muscle, and it's the contractions that help to force the urine down into the bladder. Then we have the bladder itself, also called the urinary bladder. I'll put the whole name. That stores the urine until it's expelled from the body. Layers of muscle help with expansion. And this is true. So the way that the muscle layers are arranged allows the bladder to expand, but then be able to go back to its original shape and size. Two sphincters to help hold the urine, for obvious reasons, right? Help it to not leak out when it shouldn't. And then finally, we have the urethra, the small tube that extends from the bladder out of the body. In men, the urethra is much longer because it runs the length of the penis. In women, it's way shorter, which is why women tend to suffer from UTIs or like bladder infections more often than men, because the distance from the urethra to the bladder is a lot shorter in women. Okay, label missing parts of the kidney. This is the renal cortex. And then we have this red guy here is the renal artery. Red because it's showing that this is oxygenated. And the blue or deoxygenated means that we're looking at a renal vein. Then we have the renal pelvis, and this down here is a ureter. Okay. All right, let's move on. Okay. Blood flow into and out of the kidney. This is pretty basic because we already know that oxygenated blood is coming through arteries. So blood enters via the renal artery. And it exits via the renal vein. Deoxygenated at this point, the nutrients and everything else have been dropped off. Okay, now let's talk about the nephrons. Nephrons are located in the renal cortex and extend into the renal medulla. So this here is showing us this. It's showing us a little subsection of this, essentially, up here, okay? So we have these nephrons, which this kind of whole thing is a nephron. So there's a couple of them shown here too. And it starts up here in the cortex and then dives down into the medulla. Okay. The nephrons are where the filtering of wastes and filtering of blood in wastes in the blood actually happens. And the process is a little bit complex just because there's a lot of different steps and different substances get filtered out. Urine gets concentrated at specific points along the nephron. And so we'll go over some of those, but I'm sure you'll get more in phys. Kidneys tend to be one of the more complicated organs that you're going to go over. It's part of one of the more complicated systems because of the complexity of the kidney and how it interacts with everything in the body. I told you that if something goes wrong with kidneys, it can be really hard to regulate other things with the body, and that the heart and kidneys especially don't play well together. If something is wrong with one, it tends to affect the other and vice versa. All right, so let's look at this. Vascular components. Vascular components meaning obviously the components that are going to be carrying blood, okay? So we have the afferent arterial. Let me see if we have, yeah, it's right here. So notice that we have the renal artery, which is bringing blood in, and then that blood is going to pass off through the afferent arterial. Okay, so this is where we have blood coming in. It supplies blood from renal artery to the glomerulus. Okay. All right. So the glomerulus is this globby ball right here. And the glomerulus is actually where we're going to have the blood part filtered. Okay. So the glomerulus is part of the nephron. And it's going to filter the blood that's coming in from the afferent arterial. Where blood is filtered. It is a knot of capillaries. Okay, remember that capillaries are the super tiny blood vessels that are only like 1 cell wide. And so there's a bundle of them. And it's going to go through the glomerulus. And the glomerulus has a couple of different parts to it. We'll go over a little bit of the basics for that. But as it goes through the glomerulus, it gets filtered. Now, once it passes through the glomerulus and has been filtered, it's going to leave again, and it's going to leave through the efferent arterial. So if you have a hard time remembering which is which, always think about efferent as being the exit. Okay, so exit for the blood. Okay. And again, notice, actually, let me erase this for a second right here. Notice that when it comes to this and entering and exiting with the arterioles, that we're not looking at veins here. Notice that these are afferent and efferent arterioles, not venules, okay? So the blood's gonna come through the glomerulus, renal artery to the afferent arterial, filtered through the glomerulus, and then out through the efferent arterial, still looking at artery stuff, okay? Okay, now in addition to this, we have something called the peritubular capillary network. Capillaries that wind around the tubular components for additional exchange, and then those are going to empty into the renal vein. So basically, the peritubular capillary network is being shown here in purple. Okay. And it does exactly what it says. The tubular components are the tubes where urine and water will be passing through. And so the peritubular capillaries that wrap around those tubes allow for more exchange of waste and ions and things like that across the membranes of the tubes. Because like I said, along this whole nephron, there's different substances that get absorbed or released in different places. And so all these extra capillaries help that to happen along the way. So we just talked about the blood vessel components or the vascular components. Now we're going to talk about some of these tubular components. All right, so we have something called, oops, there we go, the glomerular capsule, are also known as the Bowman's capsule. To be honest, it may have changed in recent times, but I have always seen this mostly referred to as the Bowman's capsule. But it is this bag-like things that is around the glomerulus, okay? So the glomerulus is that knot of capillaries, and then we have this capsule around it called the Bowman's capsule. And this is where the filtered blood is going to pass, okay? Let's follow the blood again. Blood goes in through the renal artery to the afferent arteriole, gets filtered through the glomerulus, sent to the Bowman's capsule, and then exits through the efferent arteriole. Okay, so just added that step in there. All right, so now we're going to look at the proximal convoluted tubule, which is being shown here. Okay, proximal convoluted tubule. This one has a brush-like border. We know that whenever we have little projections coming off of the cells, it's usually for more surface area, and that's the case here. Okay. And this is where a lot of the reabsorption is going to happen. Reabsorption of essential components from the blood, from essential ions, nutrients, some water. Okay. Then we're going to go down here. So again, this is our proximal convoluted tubule. Here we go. It's going to dip down into something called the loop of nephron or the loop of Henle. And again, just like with Bowman's capsule, I usually hear this referred to as the loop of Henle, but you can use it interchangeably. You have a descending and ascending loop here. It doesn't look like we're going to go over that necessarily, but there are a couple of different things that happen depending on where in the loop the blood is at, where the early stages of urine, I'm trying to figure out how to put that, where it is. I'll probably go into a little bit more detail in Viz. Okay, so in the loop of Henle, though, overall, what you need to know is that urine is concentrated here. And again, depending on whether you're on the descending or ascending part, that's where, you know, each of those parts have something different that they reabsorb, which is going to lead to the concentration of the urine. All right, so we go from the proximal convoluted tubule down through the loop of Henle, back up through the distal convoluted tubule, which is up here. Here we go. Okay. Up through the distal convoluted tubule, and that is going to be the site of most of the ion exchange. Ions, we're talking about things like sodium, potassium, some of the other ions that are in the body that have to be regulated, which are essential for the heart to function, essential for hydration. The kidneys are in charge of monitoring all of that, seeing if the body is dehydrated or not. It has to do with how much water it allows to go into the urine, but also what's happening with the ion exchange, because remember that water follows the ions. Water likes to go where the solute is. So the kidneys have a really complicated job, which even at this point you can probably begin to see, because not only are we filtering blood, but then we have all kinds of different substances that are being absorbed here, all kinds of substances that are being filtered out, and then the body or the kidneys are responsible for making sure that not too much water is let out of the body, making sure that the ion concentration is correct so that the body stays hydrated. There's just so much work. But part of homeostasis, part of blood pressure. I mean, the kidneys kind of have their hands in everything. All right, following our passage through the distal convoluted tubule, we end up in the collecting duct. That collecting duct is going to carry the urine to the renal pelvis. And from the renal pelvis, it will be dropped into the ureters and then down into the bladder. I'm going to pause here actually, and I'm going to go back for a second. All right, so let's find an obnoxious color. This should stand out. Just again, an overview. We have the nephrons where filtration takes place. The nephrons start up here in the renal cortex, and then they descend into the renal medulla. I really circled that too much because I went as far as the pelvis, and that's not where it should be. Let's try that again. I'll try not to be so excited about circling. Okay. All right, so the nephrons line all the way around the kidney, so it's not like there's just one or two, all around the cortex, dive down into the medulla. Once we get down into the nephron itself, we're looking at the renal artery. This is where blood is coming in. Blood comes in from the renal artery, goes through the afferent arteriole. The blood gets filtered through the glomerulus, which is that knot of capillaries. The filtered blood is then collected by the Bowman's capsule, which is out here, before it is then picked back up by the efferent arteriole, which leaves the Bowman's capsule and the glomerulus. Okay, then we have the blood going through our capillary network here, and through the tubular components, like our proximal convoluted tubule, we're dealing with what's going to become urine. Okay, so all the stuff that the glomerulus filtered out is going to start moving through the rest of the nephron, where it's going to be made into urine. So we go through the proximal convoluted tubule, geez, I can't talk, and then down through the loop of Henle, back up through the distal convoluted tubule, down through the collecting duct. I'm going to come back up here to this top image. Once it reaches the collecting duct, it's going to be dropped here in the renal pelvis, at which point the urine is then going to be taken down the ureter to the urinary bladder. There you go. All right. So this is where I left off, because I took you on that little tour. Disorders of the urinary system. UTI infections are often called UTIs. They are most common in the bladder and the urethra. Usually this is caused by good old E. coli, which we have in abundance in our intestinal area. However, it can be caused by some other crazy things. And of course, now that I'm going to say the name, I can't think of it. Nope, I can't think of it. It'll come to me. There are other types of bacteria that aren't quite as common that can cause a bacteria UTI as well. That's why a lot of times with UTIs, they will send the urine off to culture to find out exactly which type of bacteria is causing it. And then they can switch medications if needed. Shoot, what is that called? If it comes to me while I am still giving the lecture, I will tell you. There's several different types. It's right on the tip of my tongue. It's like right there. Do you ever have it? It's like right there and it just won't come out. It's gonna drive me insane. Okay, let's continue. So UTIs can cause burning urination, cloudy urine, and a frequent urgency to urinate. It is most common in women for the reason I've already said. And that is simply the fact that women have shorter urethras than men. So it's easier to get up there. Yeah. And while these symptoms don't sound pleasant, they also don't do them justice. It's very, very unpleasant. Very a lot. Untreated UTIs can crawl up the kidney. That sounded terrible. That's kind of what it does. The bacteria can move backwards through the ureter and infect the kidneys. And then you end up with a kidney infection. I've heard that those are as painful as kidney stones. It usually has a high fever, tremendous pain, vomiting, kind of awful. Kidney stones, I do have some lovely experience with. Worse than childbirth, hands down the worst pain. Just got to throw that out there. They tend to be made out of calcium, phosphates, uric acids, and then sometimes proteins. These are the three most common: calcium, phosphate, uric acid. And there aren't really cures. Some of them are caused by dehydration, meaning that your nephrons are filtering out all of the waste in your blood, but they don't have enough water to mix that waste with. And so the waste crystallizes and forms these little stones, which then get lodged. Usually they can get lodged anywhere in the kidney. And if they're large enough, they will block the flow of urine. And then if they move out into the ureter, they can block the ureter. Usually it's when kidney stones get into the ureter, although cause tons of pain in the kidney too. Normally when they're moving, and if they're too big to move without causing some obstruction, that's where you get the pain from. Yeah, so one of the reasons why hydration is crazy important is because your kidneys have to have something to combine all of the waste with. And this is probably not your favorite thing to picture, but if you go to the bathroom and your urine is super dark, like yellowish, brownish, orangish, just like really dark, you're dehydrated. That means that you don't have enough water in your system for all of that to kind of be effectively, all the waste to kind of be diluted. So it's really concentrated. When you increase how much water you're drinking, your urine can come out pretty much clear. And it doesn't mean that it's not filtering waste. It is. It's just that you've got an excess of water so that all of that can be filtered out and added to the water so that your urine is clear. That means that your body's not having to suck up every last drop of water because you're so dehydrated. It means, hey, we have enough water to keep in the body and to use to make urine. Yay! Yeah, so water, lots of water. Anything that you drink that isn't just water tends to have solute in it, which has to be filtered out. So drinking soda, which I like soda, I do. Try to drink as much water to kind of balance that out. Cream soda is my favorite. It's freaking amazing. Cream soda. But if I'm going for caffeine, it's going to be Coke. Yep. Anyway, but all of that has a lot of solute in it, which adds to your dehydration. Okay, because water likes to go where the solute is, and so the more solute that has to come out, the body is like fighting harder to keep that water in the body instead, and yeah, there you go. Okay, kidney stones, continuing. I already talked about this, can block renal pelvis or ureter, which requires surgery. They find out that you have calcium or phosphate stones. There are supplements. They're not really medications because they're more supplements that you can add in. Basically, those supplements make the calcium bind to it instead of to itself. Kidney stones that cause a blockage that doesn't pass or that's not surgically removed causes a backflow back up into the nephrons, and it destroys them. If this happens, again, it depends on the duration. It depends on a variety of factors. Normally, if this happens with, the passing of a kidney stone, you're in phenomenal pain. If it's backing up to that point, you generally end up in the ER where they do a scan, and then if it's not going to pass on its own, they're in there with stents or with the sound wave treatment, which I also now can't think of what they call that procedure. I tell you, blast them apart into smaller particles so that they can pass that way. But it's not like you really walk around knowing that your nephrons are being damaged. You're usually in enough pain that that is being monitored closely. Okay. How can you help pass a kidney stone? Okay. First off, this little image here is what a kidney stone looks like. So if you're picturing a round little pebble stone, you would be wrong. Kidney stones are jagged and pointy and have all of these crazy crystal and rough edges, and that's why they can get snagged or stuck on their way out of the kidney and into the bladder, because they are not shaped smoothly. I had a friend that had to have hers surgically removed because it just would not pass. And when they finally got it out, they realized why. It looked like kind of like this on the top, but then it, no lie, had a hook shape at the bottom. It was like hooked. So it got hooked. There you go. Sounds fun, huh? How can you help pass a kidney stone? I know this sounds absolutely crazy, but it is absolutely true. There was research done by a nephrologist. I believe he was a nephrologist. Maybe he was a urologist. I don't remember. He was a doctor. And I guess it was done by Michigan State University. And what this guy did, he took a model of the kidney and had kidney stones of various sizes in this model of the kidney, okay? Kidneys, by the way, shouldn't be much bigger than the size of your fist. They can get bigger with certain diseases, but really about the size of your fist. Anyway, so he takes this model onto Big Thunder Mountain roller coaster at Disneyland, and he did multiple runs with his kidney model with him. I can only imagine him explaining that to the Disney staff. I have to take this kidney on the roller coaster because I'm doing an experiment. And so he did multiple runs on this roller coaster. For some, he sat in the very front. For some, he sat in the middle. For some, he sat in the very back. And he found that 70% of the kidney stones passed because of the rattle type roller coasters. If you've ever been on Thunder Mountain, you know that it's a jarring, bumpy roller coaster. So apparently that movement physically rattles kidney stones loose, if you will. So yeah, I'm reading to see if there's anything else I'm missing on that, but I looked that up years ago because I was like, seriously? No, it's like actual research, published, peer-reviewed research. It's amazing. Yeah, there you go. Okay, hemodialysis. This is usually just called dialysis, although hemodialysis does describe the type, because there's also, I believe it's peritoneal dialysis, and that has to do with the location of where the filtration is happening. Peritoneal is placed in the peritoneal cavity in the body, whereas hemodialysis is done by hooking you up to an external machine. Okay. So again, this would be for patients who are in kidney failure, meaning that their kidneys are either no longer functioning or no longer functioning within the percentage required to keep your body from becoming toxic from the buildup of wastes. And again, this is going to filter blood outside the body. So blood passes through a membranous tube that is bathed in a dialysis fluid. This is going to be kind of a solute to solvent ratio type thing, okay, where it's going to pull waste out. So the blood diffused from high concentration in the blood to the low concentration in the dialysis fluid. Again, this is one of those tonicity issues where you have hypertonic in the blood, and so the solute's going to flow down. The concentration gradient to the hypotonic environment of the dialysis concentration or the dialysis fluid, okay? And as it does, the wastes are cleaned out of the blood, and then the blood is returned to the body, okay? Again, this is the kidney's job. The kidney should be doing this. The nephrons should be doing this. If there's a variety of different diseases that can take out kidney function, but then there's also external things that can cause kidney failure. Diabetes is a huge issue. Certain medications for the heart and other parts of the body can cause kidney failure, kidney damage. Traumatic injuries can cause problems. Anywho, so for whatever reason, the kidneys aren't functioning enough to keep the body from becoming toxic with all of the waste that's building up in it. So this type of dialysis removes it. Dialysis has come a super long way over the decades, a super long way. The machines are way smaller than they used to be. They used to be, I mean, what, the size of a small car. And so they've been condensed a lot, but the process still tends to be pretty darn hard on your body, because rather than your kidneys just doing it on a continual basis, dialysis is usually scheduled for a few times a week, depending on all kinds of different factors when it comes to the patient. But let's say that a patient runs on dialysis 3 times a week. Your blood is being pulled out of your body, filtered, and then put back in 3 times a week, rather than just having your blood consistently pass through your kidneys for the same process, okay? So it can lead to fatigue and headaches and just generally feeling like crap and some other things. Yeah, some people have an injury or an illness or something traumatic that's happened where they only need to run on dialysis a couple of times to kind of get the kidneys moving again, and that's because they don't have permanent kidney damage or kidney disease. Other people who are going to have permanent loss of kidney function are going to be on dialysis indefinitely. Most of them are on a transplant list waiting for a new kidney. Or if you're not eligible for a transplant, you're going to run on dialysis the rest of your life. There's something else I was going to tell you about that. I can't think of what I was going to tell you about that either. Give me a second. What was it? What was I thinking just then? I was like, oh, I need to tell you. Nope, just not there. Can't keep it in my head. Anywho, that is how dialysis works and kind of why. And that is the end of this lecture. And again, you're going to get more in phys, so might want to hang on to these notes, can kind of help you as a review when you get into that class for those of you that haven't been in there yet. Okay? See you soon.